Patricia. With me, Patricia Roxton-Hammond. Today I'm at the Spine and Nerve Center at East Legon, and I'll be speaking with Dr. Craig Slapinski. He is a specialist here at Spine and Nerve Center. We have a lot to discuss today. You know that anytime you're feeling weakness, numbness, loose bladder or anything in connection with your spine, having a back pain or a neck pain, Dr. Craig Slapinski is the best person to come and see because he's a specialist in this area. Welcome, Dr. Slapinski.
Thanks so much for having me, Patricia.
Forgive me if I have to slow down pronouncing your name.
You got it right.
Thank you. I'm so glad you gave us this opportunity on Health with Patricia to educate our populace on some of the back pain, neck pain, and some issues we've been experiencing, the numbness, the tingling feelings, and all of that. You know, mostly when it happens, we just go and see the general practitioner, or we just go to the pharmacy, get over-the-counter medication, and that's it. But I know you're going to give us all the education we need in regards to our spine. So today we are going to be discussing back pains, chronic back pains. I believe everybody, apart from the children, I believe all the elderly have experienced one back pain or the other. But today, Doc is going to explain all of that to us. And please, if you need any help, locate Spine and Nerve Center at East Legon. Come and see Dr. Craig and his team. They're always available to help you.
Yeah, thanks so much. You know, our goal here is that we are correcting the cause of the problem. We're not just masking the symptoms. You know, if you're having, severe chronic back and neck pain and then you just decide to take some pain medication, it doesn't correct the problem. And then in fact, it causes the problem to get worse and worse because that pain is there to tell you, hey, there's something wrong. That pain says, you know what, maybe I shouldn't lift this heavy object, maybe I shouldn't be bending, maybe I shouldn't be in the car too long, because that makes the condition worse. Okay. So if we're taking, pain medication that decreases that pain signal, it will make things worse in the long run. Okay. So we're correcting what is exactly making that pain happen.
Okay. So let's just get to the lowest of it. Let's start from the very low questions. What actually causes the back pain?
Right. So when we're talking about severe and chronic back pain, I have a model of the spine here. So these are vertebrae, and we have two bones that are separated by what's called an intervertebral disc. And this disc acts like a cushion between the bones. And it also protects the spinal cord that we have. So this is the nerve that comes from your brain, and it comes all the way down. And then it separates out and goes into your arms, and it goes into your legs and feet. So a lot of times what happens when we're having severe problems is that disc bulges out. So the disc bulges out, and then it hits the nerve, and then that causes the pain. Okay. So that's essentially what's happening.
Okay. So who is at risk of this? Is it anybody at all?
Well, for disc issues, it's more often people that are, older than 30. Okay. If you're in your 20s and you have an issue like this, more likely it's from trauma. You were in an accident, you fell, or you lifted wrong. But once you start hitting 30, what happens is that this disc gets weaker and weaker. So I have another model here, and this model shows a normal disc. Okay. So if you can see, in the center we have a jelly, and that jelly is surrounded by a fibrous tissue. Okay. And if we look at this fibrous tissue under a microscope, it's a matrix, and so it's supposed to be nice and tight. But as we get older, that matrix begins to weaken, and it gets looser and looser and looser, and then it's not holding that jelly in. So eventually it looks like something like this, where the disc begins to push out, and then when we have a problem, the disc is pushing out, and then it's hitting the nerve like that. Okay. So as we get older, your back essentially gets weaker and weaker.
It has nothing to do with your activity because you're getting old.
Well, absolutely. I mean, it does depend on like your age, But also depends on like your activity, what you're doing all the time, if you're at a desk all the time, if you're sitting a lot, or if you're driving a lot, or if you're bending and lifting. All these things cause little micro traumas in this fiber that add up. So if you're very inactive or if you're overweight, that's going to cause this disc to break down.
If you're inactive?
Inactive, yes.
Okay, so it looks like no matter what you do, the spine will one way or the other be affected.
Well, you know, if you're doing a moderate amount of activity or you're exercising, or let's say you have a desk job and you're getting up and you're walking around a little bit, you're not just sitting stagnant, because your disc doesn't get direct blood supply. It only gets nutrients through the surrounding tissue. So if you're not moving, your disc will begin to break down quicker. Does that make sense?
Yeah.
So if you're not getting movement in the disc, then little by little the disc will break down and you're going to lose the hydration and you get little fissures in the disc.
Okay. So even with the desk that's sitting, is there a particular posture?
Well, you know, you want an office chair that has proper lumbar support. But I think the most important thing is that you're getting up and moving around while you're sitting. Okay. You can't just sit at your desk for hours at a time without getting up and moving.
There are some, sorry to cut in, but there are some activities or there are some offices that requires that you sit for longer hours because of what you're doing. Maybe, for instance, you are editing and it's time bound, you need to sit for hours, or I don't know if you get me. Yeah,
no, I get it. I mean,
even if you're a doctor, sometimes you need to sit for longer hours.
It's true. You know, there's a couple of different rules that I have. For every hour that you're sitting, you should be walking around or standing up for 10 minutes. Another rule that you can do is just like whenever you're on the phone, you're standing up. But another good option too is that if you are sitting down, you can't really get up, is that if you're sitting on an exercise ball, one of those big balls, that helps to keep the movement in the back too.
I know someone who complained of a back pain because he's a cameraman, he stands a lot. And after maybe 2 or 3 hour recording, he complains of his back. He's unable to immediately sit because there's this pain that circulates in his waist area, so he's unable to sit upright. He needs to bend for a while before what.
So that's exactly what we're talking about. That problem is what we're talking about. It's stenosis. So, you know, he's standing, and little by little that disc gets bigger and bigger and bigger and bigger. Then he sits or he leans forward, he takes pressure off the disc, it goes back in. So the disc in this scenario is constantly doing this kind of thing.
Okay. So when do we need to see a doctor? When do we need to come to your office?
Well, when the pain starts, well, when the pain is beginning to affect your life, you know, when it's stopping you from doing something, you know, and this is something where the sooner you come in, the better. So your cameraman that has pain when he's standing for more than 2-3 hours, at that point he needs to come in and we need to correct and heal the disc.
Okay. That's serious.
Yeah, because again, when you have a disc issue, they rarely self-resolve. They rarely get better on their own, again, because discs don't get direct blood supply. So let's say your muscle, for example, you damage like your muscle. Well, that in general heals on its own because it gets lots of blood supply, but the disc doesn't get that. So that's why it takes a lot longer to heal.
Okay. So let's talk about our sleeping posture.
So sleep. The most important thing when we're talking about sleep is the quality of your mattress. You know, it's if you have
we have several brands, so which one will be the
well, no, I don't.
I'm not going to mention any.
Yeah, I can't really mention any, but I will tell you this. I got a nice mattress not that long ago, an orthopedic mattress here in Ghana, and it's great.
Okay.
So it's not like we can't find nice mattresses in Ghana. You certainly can, but you know, you need to replace them when they're no longer, you know, when you're getting lumps or divots in them, or they're not supporting you, or you're sinking down. Then you need to change it.
Okay. When is surgery required?
So surgery is required when the disc is coming out so much that it can't go back on its own.
Okay.
And really the only way to determine that, to know that if you really need to have back surgery, is to have an MRI.
Okay.
You know, you can't go in and say, nobody can say that this person needs back surgery without having an MRI.
Okay.
You know, by that point, it's you know, the point that you really do need surgery, the condition is very severe.
Okay.
Back surgery should be avoided at all costs because it's risky. I mean, and the thing with back surgery is that you can't, if the back surgery doesn't go well, you can't go into this, it'll affect everything, and you can't go to the surgeon and just be like, hey, this back surgery made things worse. Can you undo what you did? It doesn't work like that. Back surgery is permanent. So if you have a problem and there's a problem with the surgery, it's there permanently. Also, in most cases, back surgery only lasts about 7 years, depending on what you're doing, in the best case scenario. There's different kinds of surgeries that they can do. The most common is what's called a laminectomy, and a laminectomy is where they go in and they cut part of the bone out. So we're having this disc that's bulging out like this. So in order to make room for the disc, they cut the bone.
Okay.
But that doesn't do anything to correct the disc problem, which is what the cause is. And so that disc will continue to get bigger and bigger and bigger. And on top of that, you're causing instability in the joint, and you're also causing scar tissue. The other common type of surgery is it's called a discectomy, and that's where they go in and basically they cut this disc out. But again, that only works for a couple years because it doesn't correct the disc problem, because this disc can come out even more and even more. So you haven't caused the stability here. And finally, when it's severe, they do fusion. And the fusion is where they go in and they put metal rods into the disc. And remember how we talked about how a disc needs movement in order to heal? Well, when you put the rods in, it doesn't allow for the disc to move, so the disc continues to break down.
Okay.
So none of these solutions last very long, and then you have all kinds of risks with that. You know, you get scar tissue that develops, you're cutting muscle, you're cutting ligaments, and there's nerves here. So if you cut the nerve or you cut part of the sac that surrounds the nerve, then you're going to have permanent nerve damage, and that happens.
Okay.
So I'm not saying surgery should never happen, because there are definitely situations that necessitate you having surgery for your back, but that should be the last option. You should do everything you can to try conservative management first. Okay.
Finally, away from surgery and pain medications, what can we do to help with the back pain? So, at spine and nerve center.
So what we do, you know, we have the disc bulging out. So we pull the vertebra apart. So we're creating a negative pressure to suck the disc back in. And that's called non-surgical spinal decompression.
Is it painful?
No, it actually feels good. Most people that are in a lot of pain, they fall asleep while they're on the table because we're taking pressure off of the nerve.
Okay.
So while you're doing the treatment itself, it actually feels quite good. You might be sore afterwards. That's the biggest side effect from what we're doing is soreness. We're stretching out ligaments, we're causing some acute inflammation. But there's things that we can do to mitigate that. You know, icing and using a back brace, those are the best options that we have, you know, doing that in conjunction with the therapy. So we also do cold laser therapy, and what that is that we're shining a strong beam of light into the disc. And how that works is that activates the mitochondria in the cell. The mitochondria control the ATP production, and ATP is the power of the cell. So when your cells become damaged, they become dormant. They want to go to sleep. If you're beating up the cells, they just want to tighten up. And so what the laser does is it wakens up, it reinvigorates the cells and begins that healing process again. Okay. So we do that. Those are the two main therapies, and then we also do electrical therapy, we also do spinal manipulation, and then active rehabilitation. Okay. So exercises and such to help strengthen the muscles that are around the spine.
Okay. Thank you very much, Dr. Craig. It has been very educative.